People are getting burned out from fighting what seems like a losing battle.
It's a bold move for Vancouver's new mayor. The creation of an Opioid Emergency Task Force has been a top priority for Kennedy Stewart, and now 23 recommendations have been made to help save lives.
We cannot ignore the fact that our drug supply is poisoned, and this is the main cause of overdose death. Unless we take action on supply, there will be no end in sight.
Investing in treatment is going to be the way we're going to protect people from dying, and that means getting people on what we call opioid agonist therapy. Opioid agonist therapy is a form of safe opioids. This is methadone, Suboxone, injectable heroin. These are other prescription forms of opioids that have been validated as evidence-based treatment for people with opioid addiction.
On average, the overdose crisis kills one person per day in Vancouver. The report is set to go before City Council on Thursday for approval and calls for a one-time commitment of $500,000 from the City of Vancouver. It's also asking for $2.7 million in funding from the province and $770,000 in federal funding.
Every day we are hearing about people who are being lost, and they come to us and we hear their stories, and talking to parents and talking to family members, it's just completely devastating. It seems like there's a really good understanding that Safe Supply is going to really help folks get what they need, as opposed to having to use what's killing them on the streets.
I've never seen a crisis impact a city or the people in that city or the first responders who work in that city the way that the opioid crisis has impacted Vancouver.
The BC Coroner's Service reported 369 overdose deaths in Vancouver last year. By September of 2018, almost 300 people had already lost their lives. In Vancouver, Andrea Macpherson, City News.